give me so much valuable information because
No problem.
because you are
Anytime.
really the expert when it comes to hearing aids. Now I have actually I have an intro for today because we got today a request from Russia. And there's a patient who has had all diagnostics, everything. He has a high frequency dimple bilateral. It's just like a typical U shape, so it goes up again in the very high frequencies. I think it's like 4 and 6 kilohertz, going to 40, 50 dB on both sides. So for all the people who don't know much about hearing tests, so what we do is we are testing the hearing. Yeah, how do we do this actually?
So we in the audiogram, we test the lowest level that the patient can detect on each frequency. So it is basically a graph about it's the frequencies and the intensity of the sound.
Yeah.
So we test on each frequency what is the lowest level that the patient can hear.
Yeah.
It will be the threshold on each frequency.
Yeah.
And then we will see if there is any degree of hearing loss for this patient and on which frequency.
So basically the patient needs to listen carefully and as soon as he starts or begins to hear a certain frequency.
Yes.
And one needs to imagine a frequency is like a whistling sound somehow, yeah? Depending on if it's a dark sound, or do you say low sound, or how do you describe
Low
that?
frequencies or high frequencies.
But how do you describe it for the patient? Do you say it's a dark frequency or it's a...
So we say to the patient that you will hear different type of sounds. You have to press as long as you are hearing the sound until you stop hearing anything, you remove your hand. And then when there is even the slightest sound, even if you feel like it's very low, it's coming from far away, you have to press. And then when it disappears, you remove your hand. So by this, we can tell what is the minimum, what is the threshold of hearing for each frequency.
Yeah, I remember I learned, when I studied medicine, I also had to learn how to do an audiogram. And we were coming from below the threshold. That means from a field where the patient would not hear, and slowly increased and asked the patient to give us the signal when they just begin to hear. And that was somehow difficult for the patient because they wouldn't know which frequency would actually come, because you can choose any, and they wouldn't know what they have to look for.
Definitely. So it's better to start with a level that the patient can really hear and is really confident that he's hearing this level, and then start decreasing until he stops hearing. And we double check many times before selecting the threshold, of course.
So by double checking, you will get, at the end, you get something like a curve.
Yes.
So when you connect all the frequency dots with each other, so the patient has to imagine that he achieves a dot in every frequency.
Definitely.
And that dot indicates how much sound pressure he is able to hear.
The minimum sound level that he can hear from this specific frequency.
Yeah. Very complicated, isn't it?
Yeah, it is complicated. It is sometimes complicated for the patient, especially the ones suffering from tinnitus.
Yeah.
They have to differentiate between the tinnitus that they have already in their ear and the sound that we are giving during the hearing test. So it is sometimes quite hard, but by doing each frequency, by double checking many times, we can make sure that, yes, this is the threshold that we are looking for.
And then if you think about it, that in the real life, we don't hear single frequencies, we hear a mix. Yeah. It's a mix of many frequencies, and our brain or the ear or the combination of brain and ear needs to figure out what it is.
It's a combination between the two.
I think actually hearing is much more complicated than seeing.
Yeah.
Also
It is.
because if you think of a sound picture, yeah, it's there only for a fraction of a second, and then it's gone. If I tell you a word and you didn't get it, it's gone.
Yes.
But if I show you a picture, you can look and look and look until you understand what it means.
Definitely.
Now, coming back to this patient, he had these two dimples in the curve in the typical high frequency area, and they have done all the tests, MRIs, and you name it, and he's suffering from tinnitus. And they are now wondering if we can help from far with some advice for the tinnitus. And the tinnitus is what the people are also asking me. I think in Arabic it's called tanin.
Yes.
Tanin, and it's funny, it has nearly the same name, yeah. And so many patients are asking, what is this? Why do I hear this?
Yes, so the tinnitus is like whistling or ringing in the ear. The patient will think that there is an external sound, but it is actually a fault signal given from the nerve because there is a damage there. It is giving a signal that there is a sound when there is no sound. So it will be continuous. And it has a lot of reasons why the patient is suffering from tinnitus. Sometimes they have some tumor on the auditory nerve. Sometimes there is it is related to the hearing loss. If there is a trauma, all this can cause tinnitus.
Yeah, the tinnitus is definitely something that needs to be, or that is asking for further investigation until you can just say, okay, it's just a harmless sound, because it can be a symptom for also diseases that need to be addressed quickly or soon. Now, this patient, he has it for a while, for a long time, and as far as I know, there is a treatment for this, which involves also a device that needs to be put in the ear. And I know from you that your company, or the company that you are representing, which is actually a German company, and it comes even from my home city, Hamburg, I think. I can say it, it's Hansaton.
Hansaton, yes.
And Hansaton, they have done some research on this field and developed a device that you need to, or that if you have, for example, this kind of hearing problem, which is called tanin or tinnitus, that you can put in your ear. But you have to actually put it for a while in the ear. Is this correct?
Correct, yeah.
And it helps you to get rid of this.
Yes. It is actually, there will be inside the hearing device a tinnitus masker. So we can put an external sound inside the hearing aid. It will help the patient to focus on the sound, and with time they will stop hearing the tinnitus. But it is a long process, and the patient has to be convinced and have the energy to try this device, because some people use this device for 1 month and then they stop hearing the tinnitus. Some people needs more time. Some people, even when using this tinnitus masker, once they remove the hearing aid, the tinnitus will come back immediately. So it is depend on the patient, the reason of the tinnitus, and there is a lot of factors that play a role in this process and the success of the tinnitus masker.
Yeah, in my experience, it is really very much depending on the patient. A little bit like also if they if they always look in their head, if the ringing is still there, search for it, and that is definitely not so good. Yeah. So they should just take it easy and let it go. Give it the chance to go away, basically. And just let go.
Definitely, because if they are focusing on it, it won't disappear.
Yeah.
They have to retrain themselves to stop thinking about the tinnitus and focus on something else. For example, this tinnitus masker noise. So they will start ignoring. When they start ignoring it, it will disappear.
But do you see very often patients who require this kind of device, or is it not such a common, how do you call it actually? Device? Hearing aid?
It's a hearing aid with a tinnitus masker, because basically all handset-on hearing aids have the tinnitus masker. But
really?
You can activate it or deactivate it. It is off
really
usually,
cool.
but then if it is required, we can turn it on and for the patient so they can use it.
So last time when we met, we were talking about all the variety of hearing aids that people can have. So a hearing aid is. The word is really not so nice because I often ask patients, "Are you having hearing aids? What aids?" Yeah,
Yeah.
I rather like to say hearing device or machine or so. Yeah, the people like that word more. And anyhow, so when they say, I have a hearing aid or so, then I know already they are a little bit like more advanced in their demands on life, because there's a huge group of people who don't even know that they could hear much better, and that there is something out there for them which would improve their quality of life drastically. Yeah. What is it what does it mean for people? How is, in your experience, how is this when somebody comes and gets the hearing aids for the first time and gets this impression of another hearing? What do they tell you? How do they describe it?
So of course it depends on each person, but the majority of people, when we put the hearing aid and turn it on, they feel really shocked about the sound, because they were not used to hear all those sounds. So most of them tell us after the trial period, they tell that they are really happy, they are really enjoying, they stopped struggling, they are doing much less effort to hear, especially in noise.
Yeah.
So it will help a lot.
And that's actually a thing that you can't even imagine how this can technically be possible, that you in a noise environment, your hearing device, your hearing aid, can help you to hear the voice of a particular person clear and crisp.
Yes.
How does that work?
So there is some features inside the hearing aids that will decrease the background noise, which is basically low frequencies, and focus on the speech signal. So the microphone will pick up the speech and amplify it, and it will decrease the background noise in order to provide better sound quality for the patient, especially in those difficult environments.
So the programming, the software in these hearing aids has drastically, it's just probably exponentially improving in the past years.
Definitely.
So the idea of having like this big chest of microelectronics hanging behind your ear in some ugly brown color or so, this is a thing of the past, isn't it?
Yes.
Yeah.
Yes. Now the hearing aids are smaller, more aesthetic, we can choose different colors also, so the patient will accept it more than before.
What types of hearing aids are there on the market?
So there is different types. We have the one completely in the ear canal. It will be the size of the ear will be taken, and then the hearing aid will be done based on the size of the ear. And also we have behind the ear hearing aid, which is the big one with ear mold inside the ear. And also we have the receiver in the canal, which is smaller behind the ear with a very thin tube going inside the ear. And this one is the most popular nowadays because it's very small, and we can put a high power on this hearing aid. It can have big power, and it is with small size. It comes with small size and barely visible. It is barely
cool.
visible.
Yeah, I know. You see basically only if you look, you see a thin tube, just like a plastic tube or so, reaching from behind the ear towards the ear canal, to the opening of the ear. And I mean, before, a few years ago, the most popular was probably everybody wanted to have this completely in the canal, the CIC device, which is like a bean that goes into the ear and completely blocks the ear canal, and only a wire is looking out. But I heard actually from patients that it's not so super comfortable to wear because it feels like gives the fullness feeling in the ear also, isn't it?
Yes. So this type of hearing aid is for specific people, because if someone has the type of audiogram that we were speaking about, they have normal low frequencies and they have only high frequency hearing loss. When you block the ear with the hearing aid, all the sound that will come through the hearing aid and the amplifier will be amplified. Even if we do a lot of compression and fine tuning, those sounds will be amplified and the patient will hear echo all the time, especially in their voice. However, for people with hearing loss on all frequency, they might benefit from this hearing aid. But from my experience, I really don't recommend those hearing aids, because with prolonged period of usage of those hearing aids, there will be some infection in the ear. The hearing aid will be damaged faster than the one behind the ear, because there will be a lot of wax and sweat for the prolonged period of usage. So it will be damaged a lot, and it needs a lot of care. So, and the sound quality also will be a little bit compromised, because inside the CIC we can put only one microphone because it is very small. However, in the receiver in the canal, we can fit two microphones on each side. So this will help better, especially in noisy environment. And the receiver in the canal, the front microphone will pick up the speech, and the back microphone will reduce the background noise. So we always prefer, from all the sides, the sound quality will be better in the receiver in the canal than the CIC.
I want to ask you something. I forgot to ask you this last time when we met. Maybe you cannot give me the answer to this. I came across some advertisement about the latest technology in hearing aids, the contact lens for the ear. So it's some kind of hearing aid. I think they meant the CIC hearing aid, but I'm not so sure, because according to them, the hearing aid will be lying directly on the tympanic membrane. Have you ever heard about this?
Yes, I've heard. But I know the last time I read about it, it was still under studies. I don't know if they started doing...
maybe it was not advertisement. Maybe it was a study that I read, or an article which was not... Unfortunately, it's also not... It's not present for me because I haven't heard about it in the meantime anymore. contact lens for the ear. Maybe there's something coming up, we don't know. But there are also other types of hearing aids, not only those that are transporting the sound in the ear canal, but also, by the way, did you ever hear about the system where you implant a titanium tube from behind the ear, that it works like an additional ear canal?
Okay.
So you make the ear canal, which is just one canal. You make an extra canal that meets this canal in the middle.
Mm-hmm.
I fitted a few of these in Germany, and that system. So this titanium ear canal ends behind the ear, and you have to, with a cone, you have to stick the hearing aid on that ear canal, yeah? Which gives you this kind of openness. And it is good for people who cannot have anything in their ear canal. Yeah? So they have this kind of. Yeah.
Isn't it the bone conduction hearing aid?
No. It's a titanium tube that is very complicated. From two sides, you need to screw it. Yeah, from outside and from inside. It's a little bit difficult to fix, but you can do it on a local anesthetic in the clinic. The brand is called Retro X. Have you heard about that? Retro X.
Yeah.
It was actually good. They were making some kind of They promoted it with rock musicians and so on. But I heard this is also not on the market anymore. It was probably. I think the problem with the patients that I had at that time, they lost this hearing aid and they wouldn't notice, because it would fall out and then got lost, and then they just said, "Oh, I don't want to say the word, yeah."
Yeah.
So, but you just mentioned bone conduction. So,
Yes.
What would that mean, bone conduction? So, obviously, not this kind of semi-implantable hearing aid that I just mentioned. It's a different one, yeah.
So this type of hearing device is for people with problem in the outer or middle ear. So if the patient has, for example, atresia, they don't have the pinna to fit the hearing device.
Here I need to interrupt you. So atresia means that the ear canal, the outer ear canal that we can see, the hole that is in the ear, that reaches into the head, that this is congested, is closed. Yeah? It's not open. Yeah. And the pinna is the shape of the ear. We call that pinna. Why is it called pinna? Just like that?
I don't know.
So this is the technical term for your ear is pinna. Yeah?
Yes.
So you can say to your children, if they are not quiet, they get something on the pinna.
Yeah.
This is a good tip.
Yes.
For fathers and mothers. Listen carefully. All right, good. So if you have atresia or a malfiguration of the pinna, then it's difficult for you to have a hearing aid.
Definitely. So we can put the bone conduction hearing aid that will directly stimulate the organ of hearing, which is in the inner ear, which is the cochlea. So because the cochlea will be, in this case, for example, it's normally functioning, but we need something to, we need the sound to enter inside the ear. So it will enter through bone conduction.
Yeah, so the cochlea is an organ that is embedded in the petrous bone, which is some kind of a thick, bony part of the skull. Yeah? We have two of these on each side.
Yes.
And they look, when you open a skull and you look on the bottom of a skull, they look like two mountain ridges. Yeah, and in deep inside this mountain, you find the cochlea. It's somehow the safest place in the body.
Yes.
And it's like a vault, also like a safe. Yeah, and the cochlea is a very sensitive organ. It's also not only perceiving the sound, there is also a part of it connected, the vestibular organ, which is perceiving accelerations of our body. And the vibration of the bone where it sits in, like earthquake vibration, basically.
Yes.
Yeah, this will be perceived by the cochlea when you do a bone conduction, correct?
Yes.
It's like seismic waves in the mountains.
Yeah.
And that's more accurate than actually the sound that comes from outside, is it? Or is it less accurate or same accuracy in terms of, I mean, how do the people hear with this? Very difficult to say, huh?
Yeah, we need to ask them.
Yes.
I'm kidding. Hearing through bone conduction will help those people because the sound will be more natural. More natural than hearing with cochlear implant, because in cochlear implant it's a whole different system. It's electrical stimulation. However, this one is mechanic. It's through vibration. The sound is collected and then the device will vibrate and stimulate the cochlea. So the sound quality will be different.
And then there are not so many brands who do these bone-anchored hearing aids. Or does Hansaton make it?
No.
But you do not only have Hansaton in your portfolio. You have also other brands. So do you also sell those bone-anchored hearing aids?
No, we don't. But we have another brand for cochlear implant. We have Advanced Bionics. And also we have ear protection from Phonic Communication.
What is that?
It's a device, earplug for people who work in heavy industry, for musicians. It will protect their ear. Why they can still hear the speech and all the sounds, but it will reduce the noise. So without compromising their hearing level.
That's really also interesting. I think there's so much demand on it. Don't the people queue in your shop to get this?
There is a lot of people taking this, especially DJs, musicians. Yeah. So they can enjoy their life, enjoy their work without compromising their hearing level, which is amazing.
Yes. I know someone I will send to you, a DJ who is always having problems with his ears. But also truck drivers, they always have in their left ear, they have a problem, because they have the noise on the left ear. Is this right?
Yes.
Yeah, so with the hearing, there are many technical solutions. Coming back to that, did you hear also about these hearing aids? If you have a middle ear present, so you have just the atresia of the ear canal, and then there are hearing aids that are connected with ossicles in the middle ear, and put the vibration on those. Do they have any advantage to the bone-anchored hearing aids? Did you hear anything about that, or?
I think it is still also under investigation to see if it will be better than the bone anchored or not. So they will try it with patients and see the difference, which one they are comfortable more with. And all
this is also my level of information, because unfortunately these systems are not really cheap. They are quite expensive, and to find an insurance that covers the expenses for that is often not so easy.
Yes.
I think you're struggling a lot with that to convince insurance companies to cover the expenses for hearing aids.
Yes, we are.
Yeah.
Because they think the hearing aids and the glasses are accessories. So this is why most of the insurances won't cover it. So we struggle.
Yeah, funny, So all our senses are accessories, for example, I do in my clinic a treatment for the sense of smell, which is for people who lost their sense of smell. I do a special PRP treatment, but there is also not yet much evidence that it helps, and it doesn't always help. But it is a good chance for those people who lost their sense of smell. It's not covered by insurance. They don't want to hear anything about things that are just for the chef who wants to continue smelling his food, or the sommelier or so. Yeah, when it comes to hearing aids, what is the latest thing that comes in your mind, the latest development? Now the otology conference is coming up in 2 weeks.
Yes.
Is it open for everybody to come and have a look to the otology conference?
For all the E.N.T doctors and audiologists and the companies, the provider of product, for example, hearing aids, instruments, cochlear implant, and all those, they are. But you have to register for.
For example, if I'm now family, I know my mother, she needs a hearing aid, or so. Could I come to the otology conference and have a look in the industrial exhibition, or?
They have to register before. There is, because a limited amount of people who can
come.
So they have to register, and they can go and see the conferences and everything. But I think it will be a little bit hard for someone who is not related to a company or expert to go inside the
How can
conference.
Let's say normal people who have nothing to do with medicine, how can they get information about hearing and hearing problems?
Listening to your podcast. And also on social media.
Are you present on social media?
Yeah.
Okay, good. So we need to link this with the podcast.
Yes, we have Sky Medical Instagram page. We always put a lot of informative videos for our audience, and also we put some cases from our clinic, some patients, especially patients with cochlear implant, how they started with surgery, and now they are started developing speech. So we put some videos for their.
The cochlear implant topic is a special topic. I think I want to invite you to come for that extra, that we can talk about cochlear implants.
Definitely,
because
I would love to.
I know that it is also, let's say, very satisfying topic. For if I think it's a lot of emotions involved with cochlear implants. And today I just wanted to introduce you to my friends and Paula, the beautiful lady from SkyMed.
Thank you.
Who is giving you all information about, and she knows everything. You know really everything about hearing aids. This is just amazing. It's not always the case that we come, let's say, when you go to any shop, that you find someone in charge who knows their product. It's not always the case. I'm sure you have made this experience as well. But with you and your team, I believe everybody knows the products very well and knows the right hearing aid for each and every person who wants to hear better. And I actually heard that in the future, for example, one of the advices for investment in the stock market is some kind of Italian company or so who owns big shares in hearing aids worldwide, and they predict this market to be really, really big in the future, because the demand of elderly people to have a good hearing and to participate in the world will rise.
Yes.
What does that mean, actually? The meaning, we just briefly said, okay, this nice, the people are happy to hear the sounds, but what does it socially mean to have a hearing aid?
So for someone suffering from hearing loss, when they are in a group with a group of people or a noisy environment, they feel like they are isolated because they cannot understand. They feel shy to say to the other person, to repeat what they already said, or sometimes they won't understand what the other people are saying to them. So with time, they will start to become isolated, develop depression because they cannot connect with other people. So while using the hearing aid, it will help solve this problem. They can live their life to the fullest, to all the activities, go work and socialize without any limitation using the hearing devices. So it's very important for anyone suffering from hearing loss to get his hearing tested and get the appropriate hearing device in order to minimize the negative effect, not only socially, but also a lot of studies are now speaking about the relation between hearing loss and dementia.
Oh, really?
Yes. So
the stimulation for the brain, I believe.
yes.
Yeah.
So this is also very important because there is a lot of negative effect from hearing loss, not only socially.
In which age do you think this begins? From what age onwards? I mean, apart from those people who have, due to disease, early childhood disease, also the hearing loss, or is due to some sudden hearing loss or so. But the natural decay of the hearing, when does that begin?
Around 60s, we can say 65 and more. So those people should start checking their hearing annually and see if there is any development of hearing loss. They can start using a hearing aid in order to also prevent the progress of the hearing loss, because the hearing aid will always stimulate the nerve, so the level of the sound the hearing loss won't progress more while using the hearing aid. And this I saw in a lot of patients that are using, for example, hearing aid on one side and also they have hearing loss on the other side. When doing annual checkup, we can see that the side using the hearing aid, the level of the hearing is somehow still the same. But for the ear that we don't put any hearing aid, it has decreased more.
This is the most important information of this entire talk here.
Yeah.
Because I mean, people are, in my experience, people are hesitating to have a hearing aid because it is like a stigma. It stigmatizes them as old people. And I was always thinking, why do you mind that? But you would take easy the reading glasses, for example. Yeah, and last time you taught me that actually my information was wrong to wear the hearing aid only when you need it. Yeah, and that fits to what you just said. But also, even if this is. Even if it's better to wear the hearing aid as long as you can, I think by participating in the social life, you stay much younger. Yeah,
yes.
Because you get the wording of the younger population. You can be with them and you can join them in all activities much better, and you are not outcast, and you are also welcome in the group. Yeah, because I think I would say if I would see someone in a group who's always outside, at a certain stage, you would try to get them in, but then everybody gives up, and then at a certain point you're not invited anymore. I think this is what's going to happen. Yeah. So if you don't want that to happen with you, you should really, if you are in that particular age group, you should really check your hearing regularly. Go to SkyMed, for example, and check your hearing, and then at a certain stage try a hearing aid, maybe a completely invisible hearing aid. Yeah, if you have hair, not like me, you can hide it. Yeah.
Also, different colors we can select the color of the hearing aid based on the skin color or the hair color. So it will be somehow invisible. But even if we can see it, I always tell people, why you are shy? If Now, what is more hard for you? To put hearing aids and people will stare at you, or to being constantly need to tell people, repeat, please repeat.
Yeah.
So what is easier for you, to be able to hear while using hearing aid, or needing to tell people to repeat themselves all the time, or hear something else?
But guess what? I think these people, they don't even ask to repeat, you know? They will just pretend that they understood. Yeah.
Like, yes, even
Pretend
if
they
it's something else.
And also in Dubai, we have a special situation of so many different ethnicities, everyone speaking their own type of English.
Yeah.
And that is not always the English that you easy understand. And if you just think about this, what I said initially, that the hearing is a matter of a moment. So if I say hat to you, yeah, and you did not get it, if I said hat or cat or fat, yeah, maybe it's out of context, or maybe because you did not get the first words or so, yeah, you would not guess which word I meant, and then you're lost. Yeah, that's basically it, and therefore it's very important to check it.
Definitely.
I think this is the best message ever we can give to the people. If you're in Dubai, if you're feeling that you're not getting all the information that your friends and family or whatever their business partners want to bring over to you, then you should test your ears. Yeah,
Definitely.
should consider the hearing aid. And it's actually good. Yeah, they are nice looking hearing aids. I wouldn't mind to wear a hearing aid, to be honest. Also, I mean, people are walking around with the weirdest buttons in their ears. Yeah.
Yeah. So the hearing aid looks better than the AirPod, for example. The AirPod is very big and it's obvious, you can see it. However, the hearing aid is more invisible. And it can have also Bluetooth and all those features, so the patient can benefit from it.
Yeah, you can also combine. What if I would wear hearing aids now and with a headphone here? Would that be actually a problem?
No, but you have to put the
Switch it off.
speaker
Yeah.
on the microphone of the hearing aid, but the microphone is behind the ear, so it will have some feedback. It will provide some feedback.
So it's better to take it out, because I can put that louder.
Yeah.
But with telephone, iPhone, or any other phone, Huawei, is there a problem? It's easier to connect.
Yeah, you connect via Bluetooth, and same as the AirPods. You can take phone calls, listen to music, videos, anything while using the hearing aid.
And if somebody buys a hearing aid from you, are they lost then at home and they have no support anymore, and then they need to figure out how that works, or do they get your support whenever they have a question with the hearing aid?
Whenever they have a question, they can reach back to us, and we give user guide for them. We tell them that we are 24/7 available. They have our mobile number. They can send us WhatsApp message if they have any problem. So we are always supporting our patients.
Because latest technology is often not so easy to manage and to understand. Yeah, there are features that are, alone features. Yeah, is already something that is for elderly people a foreign word, and they would probably not be able to utilize the hearing aid to the fullest and comprehensively with every options that it has until they get trained on it. Maybe there's even training necessary for that, yeah?
Definitely. So the fitting part of the hearing aid is very important. We have to take our time to teach the patient how to wear the hearing aid, how to switch it off, how to charge it if it's rechargeable, how to change the battery. and how to answer phone calls. So we try to teach the patient how to do everything and make sure that they know all those information before leaving our clinic. And we make sure that we give them our phone number if they have any question. And we follow up with them every once in a while to make sure that everything is going well.
Oh, that's really good.
So, yes. And also for a trial, we tell them to try the hearing aid for a good period of time to see if everything is going well. And they can always go back and fine-tune the hearing aid, or for us to teach them anything they want.
Yeah, especially if you're growing older, all these inflammation diseases kick in, and often there's inflammation of the joints, and the fingers are not working as good anymore. They cannot do the fine movements securely. Let's put it that way. Yeah. Hearing aids can fall down or whatever when they try to manipulate on them. Is there actually a lot of manipulation directly on the hearing aid necessary, or is it just battery change? Or are there hearing aids that are so easy to handle that you don't have to have the best dexterity?
Actually, yes. We tend to tell those patients to take the rechargeable hearing aid, so they just have to remove it and put it in the charger. And also there will be only one button to press to accept phone call or anything. But other than that, if they want to, for example, change the program, change the volume, increase or decrease the volume, they can do it through the mobile application also. So it will be easier than pressing on the hearing aid and increasing and decreasing the sound. So it will be through the mobile number, which will be easier for them.
Wow, very good. Very good. Paula, now I want to say thank you, because I'm afraid that that we have the same disaster as last time, that the camera switched off and we continue talking. Because the topic is really so interesting. Yeah, I mean, I have still a lot of questions, but anyway, let's leave it here. I was speaking with Paula Saidi.
Yes.
Saidi, and PaulaSaidi, and she is working at SkyMed, and she will also be at the otology conference, but unfortunately not everyone can go there. So you can reach her also, and we have the link under the website, under the YouTube channel here. And for me also, she is actually representing my most favorite hearing aid. So although I don't have a hearing aid, but probably soon I need to wear a hearing aid as well. Yeah. So it was a pleasure having you here. Thank you very much.
Doctor.